Hi, I'm Jessie Gruman, president of the Center for Advancing Health. Let me tell you just a little story about a colleague of mine. After spending weeks scouring the web and consulting with her kid's pediatrician and allergist and listening to TV doctors and quizzing her friends, my colleague has decided not to have her son vaccinated against the H1N1 virus. In doing so, she joins other mothers, pregnant women, healthcare workers worldwide, and others in rejecting the public health messages about the importance and safety of the vaccine. She's a smart, savvy consumer of healthcare, and this decision represents thoughtful consideration of a variety of information. Her decision illustrates an accelerating trend. More and more of us are responding to, on one hand, a stream of messages urging us to become active participants in our care, and an equally steady stream of news reports on the uncertainty of science, conflicts of interest among doctors, and the dangers of medical care. Now, I write a lot about how one of the unintended consequences of healthcare is that individuals have to make more decisions and perform tasks that were formerly done by professionals. Our concern is particularly what this means for people who are frail and ill and otherwise vulnerable. My colleague's H1N1 decision, however, comes from the other end of the engagement continuum. People who are curious and motivated, who know something about the process and progress and methods of science. We weigh the available evidence against our personal experiences, our values, and our preferences, and then we make a choice that may or may not agree with either our physician's expert recommendation or a population-based public health agenda. Those like this among us will not limit our consumer investigations to finding the cheapest x-ray for our sprained ankle or the best drug plan for our mom. We won't restrict our demands for shared decision-making with our doctor only to those choices that promise similar outcomes with different side effects. Nope, we have responded to the implications that we become informed purchasers of value and ask questions, and we don't believe that any aspect of this service delivery enterprise of healthcare is off limits to our scrutiny. Highly engaged patients demand a new kind of relationship with our physicians, one that requires flexibility, patience, and humility as we try to understand what's wrong with us and how what they recommend might, but might not, help. We question their experience and opinions of the latest JAMA article. We judge them on the based on the quality of their training and their publications and the ratings of their manners by other patients, and we may or we may not follow their advice. Those who exhort us to be more active in our care have made the easy assumption that if we do so, we'll make the same decisions for ourselves that our clinicians and public health officials would have made for us. That we'll stop smoking and follow mammography guidelines and then take our pills as directed and get the vaccinations. The considerable number of those who plan to refuse the H1N1 vaccine is proof that this assumption is false and that our engagement will unquestionably have an impact on our own health and the health of the public in unexpected ways.